No pressure on this one. All right, today we'll be having a Foley catheter and all that. We'll be having enjoyment. All right. All right, so with the catheter, what's the first thing we want to do when we're doing a Foley catheter? I have to have an order. If I don't have an order, I cannot be putting a Foley catheter in. I see the order, I'm good to go. I gather my supplies. Supplies I probably want is my kit. And what do I always check on anything?
Expiration date.
Look at the expiration date. This is 2027, I'm good. And then I'm also gonna look at the package. Packaging looks in good shape, no holes in it. I am good to go. I got my package. Gloves do come in this package. These gloves are about like a 6.5 to 7. They're very small. And they're vinyl and they're wadded up. They don't stretch. So to be honest with you, bring your own pair of gloves with you because these are very hard to get onto. It's easier to get these on if you want to. So I'll bring my own pair of gloves. Odds are I might bring 2 pairs because just in case I broke sterile technique, I got backup. I'll pull my backup out and ready to go. All right. All right. So I've got my kit. I come in the room. First thing I'm going to do is I come in, gather my supplies, enter the patient's room, provide privacy, hand hygiene, and I do what?
I verify the patient.
My name is so-and-so. Can I get your name and date of birth? All right, we got the correct patient. Now we got the name and date of birth. We're ready to move on. Explain the procedure. All right, so Miss So-and-so. Miss So-and-so, we're going to be putting a Foley catheter through your urethra, into your bladder and all that so we can get the urine out. You're having a hard time going, so we're going to put that Foley catheter in you. What are they going to ask me?
Is it gonna hurt?
What do I answer?
Uncomfortable.
It's going to be uncomfortable because I'm putting a tube into a hole that does not actually stretch easily, but I can put it in there. It will cause some kind of discomfort. It should not be really painful though. All right? Do you have any questions? No. Are you okay with this? Yes. Perfect. I says for allergies. What kind of allergies am I going to ask for specifically?
Latex.
Latex. Now the thing is about most of this, these are latex free. Most of my kits are latex free, but always ask for latex because you never know. You might have an older kit that has latex in it, or you might have grabbed gloves that are latex. I ask about latex. What's the other one?
The lube?
Huh?
The lube?
Not the lube so much. Most people, always a possibility that they might have some allergy to water-based lubricant. Don't know. Haven't come across it though. So it's usually not a big one on my list. But there is another thing in this kit. Not this one. Huh?
The iodine.
The iodine, or betadine. I want to make sure, do you have any allergies to iodine or betadine? Now sometimes I might say, oh, I have allergies to iodine with IV contrast. All right, so IVs, but what about on the skin? Oh, on the skin it's fine. All right. IV, going through when they're doing like CTs, if it's going into the vessels, that's one thing. It's different from being on the skin. I'm going only on the skin. I'm not going through the vessels. All right, so it might be okay, that should be fine. But if they do have allergies to iodine, if they do latex, I have to just make sure I have no latex. And if they have iodine, I have to get a different prep. A lot of times I think chlorhexidine they might use sometimes, but I'll use the chlorhexidine gluconate as my prep solution then. Once I've verified allergies, I'm good to go there. Now I'll get the bed to a working height. Now at this time when I'm raising the bed, what could I else be doing? Talking to the patient. How you doing today? Doing okay? Yeah. Been having this problem for a long time? Oh, man. This is not a great thing, is it? Yeah, I know. Nobody enjoys having Foley catheters. What's the working comfortable height for me?
No.
At my waist. Now this one, actually it's funny, the one over there, actually I was raising, actually moved up to about here. I'm like, dude, this gets even higher. This one pretty much gets to about my waist and it stops. So I'll get to my working height. Now, if this is a female patient right now and I was putting a Foley catheter in, what else do I need to have in the room with me? I need to have a female staff member with me. If you're a female putting in a male, do you have to have a male staff member?
No.
It's not the same. It's just the same as like we did in the bath. But most hospitals, a lot of hospitals are saying if you're putting a Foley or doing like any type of sterile procedure, have a second pair of eyes in there so they can watch and they can catch. If someone sees you break and they say, oh, you broke sterile technique, what do you say?
You just be like, you may want to change your gloves, and let me go get you another pair of gloves.
But if you told me that, what should I say to you?
Okay.
All right, thank you very much. Don't argue, don't debate, just change it. Because they might have seen something you didn't see, and you're not going to say to the front patient, no, I didn't do it. You don't know what you're talking about. I'm not going to change nothing. Why are you arguing? Just do it. Change gloves and take care of it. I speak from personal experience of watching 2 students argue over whether or not they broke sterile technique one time during simulation. It was funny. Sad, but it's funny. All right. So I've checked for allergies, I raised the bed to working height. Now I'm going to put a pair of regular gloves on and I will have a towel and then when we get in position. Now there's different ways I can fix the blankets. I can pull the blankets from here up to be on top of the patient and to expose them, or I can take the blankets and I can just roll them all downwards like here and put them to the edge of the bed like this and then expose them. So I can do either way, it's fine. I'll take the gown and pull the gown up. Position for, usually you do not have two legs that are both the same leg.
Oh, his toes.
Somewhere there's a patient that has two stumps. I need to switch those legs out. Ways you can do this, so there is one, when we talk dorsal recumbent, this is more of a dorsal recumbent. It's kind of like I always like calling it frog leg for some reason. Frog leg, butterfly leg, however, that's one position. The way I usually like to have it, you're gonna have to work with me today, sorry.
He's having a real rough day.
I know. I usually like, if I can, I'll do this, because I like the open area, that way I can still get in to work. Sometimes I can't maybe bend their knees that well. Doing something like this might be doing, I can only get them to spread their legs like that. That works. And sometimes you may not get much of everything. You have this and you work the best you can with what you have. I've had somebody, they said that one time they had them like in such a contraction, the legs couldn't get open. They basically had to kind of put them almost in a prone position and go from the back to get to it. It's a little bit trickier. In surgery, a lot of times they may have them all covered in drapes. They weren't planning for it to have a Foley. And then they're in the middle of the case, hey, we're gonna go another 2 or 3 hours, we need to get a Foley put in. I get somebody at the end of the table holding the drape up like this, so I'm crawling under to put a Foley in. Is it sterile? No, sterility is pretty much gone, but I will do my best to maintain as much as I can and keep it as clean as I can. They're gonna be on antibiotics and treated, but infection versus bladder damage, we'll take the infection more, right? So anyway, I used to laugh because I used to have students when they would do this, they would actually take the leg and bend it up like this. And I had this nightmare of this hearing this patient, oh, my leg, what are you doing? Oh, you're fine, keep going. But I'm just gonna put it here. All right.
Can we lay this like flat or like out this way for video purposes? Thank you.
And there may be some times that you actually have to put a Foley in this way because they can't bend their legs. So there's a possibility you will have to do a Foley this way.
All right. So now it's time, I got in position. I do pericare. What's pericare? How do I start it? Huh?
Front to back.
Front to back. And where do I start? Do I start on the thighs?
No.
Actually, for this one, you'll start on the thighs first because I'm gonna clean up and go towards the center of this one when I do this care. So front, here, here, work my way up, changing towels, whatever, and by clean all the way. Also, when I'm going through here, I will open up the patient and be looking for the urinary meatus. Because all the times when I'm wiping down, it will wink and all that. So, tricky thing with women, besides other things. Yeah, big thing about women is how many holes are there? If you say 3, I'm gonna smack you. 2, thank you. I do have people, 3? Yes, there's a hole down here. If you go down this deep, this far, you are so far off, you need to leave. But there's 2, so a lot of times what happens, and the anatomy, this is perfect anatomy right here. There are holes, it's boom, boom. I see exactly where I need to go and I can go there. Reality of it, it's not always gonna be this pretty. You get older patients who've had multiple kids. This might be up higher, might be over to the side. They might be almost like right on top of each other. That's why the question is earlier today on Cahoots, remember it said leave the catheter in there. If you go in the wrong hole, leave it there. It marks the wrong hole. Now I know I need to go up from there, all right? So this one is actually very nice. It's a good position. That's one of the hardest things probably with females. With males, what's some of the hardest things with doing a Foley for males, you think?
It'll slip. You don't have a good grip.
Yeah, so literally grab it, and I'm not trying to be rude or anything, but I say you grab it like you own it, hold it, secure it. Whatever you're doing, secure it and hold it. Sometimes it's like this. It might be only like this sometimes. Whatever you do, you hold it as best you can to get in. What else do you have that's an issue with it? Foreskin's another issue. Sometimes I've had somebody who the foreskin had so much adhesion you couldn't slide it back or something. There was something really weird. And I'm like, I can't get this back. We have to talk to a urologist and maybe they have to go in and do something. But if I pull it back and clean it, what do I need to do at the end?
Put it
Put
back.
it back.
Put the foreskin back. If I do not put that foreskin back, what's going to happen?
Strong.
Turn it.
Yeah, it constricts. It's cause damage, bad damage, and you're looking at a lawsuit, and you will lose that lawsuit. There's not much for the chance of you saying, "Why?" No, you're going to lose it, and it's not going to be pretty. So make sure you put it back. And one other issue that you might come across with men,
Turtling.
there is that too. That's a whole nother problem. But that comes back to turtling, trying to get it sometimes. But the other thing is, what was the issue we had last week on the scenario? Prostate. Prostate gets in the way, so when it gets in, that's where we use that. What was the tip we used? the coude tip.
Yeah, coude.
Get the coude tip. It helps to try to get around. Otherwise, sometimes they'll put the bed into a Dillenberg or have them take a deep breath, something, just to try to get to advance under it. Just trying to get everything to lift up and out of the way. So,
That just doesn't sound comfortable.
no, what, to the Dillenberg?
No,
Or
just in general.
no, it's not. But we try to do that. So those are some of the issues we're running across men. Now, as far as the checkoffs, which checkoff do you think we're going to use?
Female.
Females, they're a little bit more difficult as far as trying to get them open and all that, and I'll show you how. All right, so I got my kit. When opening the kit, now when we do these, a lot of times during checkoff, you might have a kit that's already been opened a couple of times. If you get a brand new package, it opens up here. So the white package is going to open up just like this, and I can reach in and touch it and pull it out. It's still sterile inside, and still good. I've also might have brought a trash bag, so let's see where we at. Raised bed, wash perineal, we did that. Examine urinary nieces. Remove, position a trash can. If I have a trash can, I might put it right near here so I can drop everything in. If I don't have a trash can, I can guess what? I can just drop it on the floor. I'll clean it up later. Some students will want to take this, and I've seen it done before, where they roll it up into a trash bag. The only issues I have with this at your level right now, because you don't have a great understanding of sterile technique, is when you guys turn to put things in it, you do this. What have I done if I had my sterile gloves on? I just broke sterile tape. You want to reach in the bag and just drop it, but you don't. You'll forget it and you'll want to hit it. So I say don't use the bag. It will mess you up. I'd rather have you drop it on the floor and take that than to mess it up. Oh, one other thing. You know, see how I put mine on the bed? You all watched ATI, right? Where do they open theirs at? You can't open it on the table. That is fine. You can move it around. I have a thought. If I can put it here, I'll put it here. I want less movement. The less movement I do, the less chances of sterile break I have. All right, that's just me. That's my thought process. The other thing is, everybody see the movie Ratatouille? Remember what she told when she was teaching him? What she taught him about his arms? Get elbows in. Keep them locked in. Keep that way you're not tempted to reach across anything. Keep them to your side. Minimize your movement as much as possible. Or if you want to, T-Rex arms. If you want to use the bag, you can also just take it, and like I said, down here at the end, I could drop things on it as well. I could do that if I want to, otherwise just drop it on the floor. All right, so what do I do next? Open that or open these?
Open that.
Open this first, because that outside is not sterile, is it? So before I put these on, I gotta get to my sterile field. All right, another real quick thing I've had students do, they will do this to me. Now, what's the first opening?
Away from
Away
you.
from you, right? This is what I get students that will do sometimes.
Trying to go around.
Oh no, I get 5 minutes of this. And I'm over here like, turn it! You can pick the package up, you can turn it, get it the right direction. It's not gonna hurt anything, okay? But I cannot stand watching 5 minutes of someone try to figure out how to move something. It's like, turn it around. Ooh, I forgot to tell that other room something. The position I'm in. Because I'm right-handed, but I'm also left-handed. Real quick, who's all left-handed here? I'm sorry to say. Anybody else left-handed? Left-handed? If you're left-handed, you will stand on this side. I am right-handed, but I can also do this left-handed. That's why I stand. But if you're left-handed, you'll stand on this side. If you're right-handed, stand on that side. All right? Because you'll see why here in a minute why I want to be on that side to control. All right. So I've got my package. I will open up away. Now, see, it's got memory there too, doesn't it? Stop it. I will hold it like this. I'm not reaching across, but see, I'll kind of pull on it to try to break that memory as best I can. Try not to touch the package. Open. Come here, open up. I can touch the edges, work around the edge. The reason I grab here and here, if I grab here and pull, a lot of times what it does, it causes these corners to go in. If I do that, it does those. So it's just easier to grab here and tug and break those up. If I want to, I can also move the package around like this. Makes it a little bit nicer, all right? At this time, can I touch anything in that package?
No.
It is sterile. When you become an expert and you can know what's sterile, when you can watch your stuff and you know better how to do it, you can touch that top thing. That top thing is the gloves. I can reach in, grab it, and pull it off, and I can open this package up and put these gloves on. For y'all, I wouldn't mess with it. Get your own pair of gloves. Keep them over here and stay away from that for right now, just until you get a better understanding of how to do sterile and non-sterile. All right? All right. So I gotta put my gloves on. Everybody remember how to do this? Not, you're gonna remember today, aren't you? All right, what,
So by next Wednesday.
yeah. All right, do y'all remember one of the big things I cannot do right now when I put my gloves on?
Put your hands below your waist.
Can't put my hands below my waist. What else can I not do?
Turn away.
You can't turn around.
Turn around.
turn around. If I do this and I put my gloves on, I broke sterile technique. If I had the table like this, I'm still good, my vision. But if that table's all the way up here, I know almost for a fact that you cannot see that far behind you. That's gonna be breaking sterile technique. I wanna make sure at all times I can see my field, so I don't see them move or budge. If I see them kick their thing, I'm like, all right, never mind, let's fix it again here and do something different. But I wanna be able to see it. Now, if you look at the wall behind you, you'll see the dot on there. You should record
Why
that
would
dot
you?
right now. It's like too much pressure in here today. All right, so glove, which hand first?
The dominant hand.
Dominant, unless of course that glove is all messed up and I can't get to it easily, then what? Go to the other one. It's okay, you don't have to always, there's no set in stone, you must put this one glove on first. No. Guess what, the gloves don't know which one's your dominant hand. I hope not. As you notice, I backed away from the thing, because remember, don't do this. Because you'll break, so pick them up, back up, put them on. Now, if I'm trying to get this one off the package, and I get this, what are you gonna do? Grab here and hold the corner. Because I'm saying this because these are things I've watched students do. I'll see this. I'm like, grab it, please, control it. All right, so I grab it, control it, pick it up. Do what I need to, pull my glove up. I hate these gloves. All right, yay me. Use my soccer skills to kick my table all the way. All right, so now I can start maneuvering things. Again, like I said, minimize motions. I don't have to be like, oh, I don't need these, I don't need this. Quit throwing everything, just pick them up. Drop them down there. I can leave them on the thing, they're still sterile. I will separate my two trays. As you notice, how do I have my trays? Where are they at in the field?
And the
In the sterile
In the
field.
middle, away from the edges, right? Not this. Not this, not half on, half off. I want them in the middle, away from the edges. That is correct, all right? All right, now it's time to put my other drapes on. My first drape is a little large drape here. There is a dull side and a shiny side. Can y'all see how that, shiny, dull? Which one's gonna go down? Shiny side goes down. There's two different ways I can put them down. I can put it this way and go down, or if I want it to go a little bit longer, it's like if the legs were that part, I might go this way with it and go down. I'll adjust it however I think needs to be, how it needs to be best. So I'm gonna go this way, maybe for this one. I can cross like this, can I? Why can't I do this right now?
Because it was sterile.
It's all sterile right now, right? So I can come across and then I'll put it up. I hate that corner though, but anyway, so I've just gotta be cautious of that corner because I don't know if it's touched, so that was also, because if I had the legs up, that would have laid down flat, but it's not because it gets in my way. So I'll put that down. Now I've got an extension. Now see, the other thing is, you notice I said I can go forward with it, but once I hear it, I cannot scoot back. It's touched. If I go backwards with it, now I'm contaminating my other field. My other drape, fenestrated drape. All right, same thing. I can either go lengthwise or sidewise. I usually like to go this way. I feel like I can get better. If I go this way, a lot of times it folds in on itself, and I hate doing it. So I will just go like this and drape it down, put it down, perfect. All right, swabs. When I've got the swabs and all that, usually they're going to come with one swab package in a kit. Swabs might be different every time you open one of these kits. It might be like these, Q-tips with soaked in betadine. It might be cotton balls with a forceps and a package of betadine, and you'll pour it on that. Or it might be just the little cotton tip or applicator is separate, and you have a package of betadine, and you'll pour it on it. So don't be surprised if you open it up and find something that's really different. It's like, oh my goodness, just calm down, it's still a kit. We just gotta figure out what we need to do. All right, so we're gonna prep it, I'm gonna open the kit. Take out my swabs, put them down here in the tray. This I could leave here, or I can toss it off. If I toss it off, get it out there because it still has betadine, it might drip everywhere, so I might put it somewhere where it's not gonna drip too much. They do have packages of lube. All kits will come with lube when I'm actually doing them. On a real person, I would use this. On the mannequins, we'll actually have some other lubricant that I would use. It's a silicone lubricant. It doesn't mess them up or gum them up as bad as like the water base. But if this was a real person, I'd open it, pour it in there, and that would create my lubricant then. All right? I have a syringe, it's got saline in it. This is what I'll use to inflate my balloon when it's time. And I'm gonna go get it right now here. Now, when I'm pulling out, you got a little tube a lot of times like this. This is gonna be like if I need to collect a little urine sample, I can collect it in here. But for right now, I'm just gonna set it to the side. In the box, I don't want to take, I see students and they always like, will drag this all out and they'll be dangling with it. Leave it in the box as best you can. The more, like you remember I said, minimize. The less I have to, if you get that whole thing dangling, you got a better chance of it breaking sterile. So all I want is this out right now. And what I'm gonna do is I'm gonna pull this off very slowly. I'm gonna control that catheter, because if I don't, guess what happens?
It'll drop.
If it hits, guess what I have to do? Start the whole thing. So I'm gonna control it, pull it out. This, if anything, I would say drop this on the ground. This thing springs back very easily. I get rid of it, just drop it. And when anything you get rid of it, drop. Not like, ooh, even if you have a trash can, don't be, oh, let me put that in there. Don't, drop, just turn, drop. Get rid of it, just drop. All right, I got my catheter. Man, that thing's big. Hold on one second. This is not, I'm gonna look at something real quick.
I thought you were gonna put it.
Huh? Should be okay. I'm just making sure it's not like split open or something already. I'm like, well, this is gonna suck. It might blow. All right, so we've got our thing. The next thing I'm gonna do is attach my syringe. Now, hopefully this doesn't blow. It might blow, it might pop, I don't know. If it pops, just don't panic. The reason, I would not usually inflate this beforehand. The only reason I'm inflating it right now because I want you guys to see what it looks like inflated. Just in case. I was like going. All right, so this is what will be. This is 10 cc's of fluid that's put in that balloon. When you put that in, that's what's gonna keep it from coming out of the bladder. It's gonna hold just like that, all right? So that's what's keeping it locked in. As you notice, I keep my thumb down and pressed because as soon as I let go, it starts to refill because this thing is very pressurized. It's gonna push all that fluid back out. So when you fill it up, you will make sure, keep it down, make sure it's in place and disconnect quickly. If you don't, if you leave that attached to it, this balloon will deflate and guess what's gonna happen to the catheter? It will slide right out and you're gonna start the whole procedure again and that patient, good chance, will not be happy with you having to do this again. All right, this time now, I've got my everything ready. The reason I wanna make sure my kit is all ready and everything's set, oh, the reason I'm also, if you notice I'm slanted like this, I'm slanted for y'all. If I was actually doing this, I would have it like this. All right, I just wanna make sure everybody sees how I'm doing that, so. So I've got my kit ready, so now I'm ready to put it in. So at this time, what I'm about to do, I'm about to lose a hand. This hand will come up and hold it open. When I'm holding open, or if it was a penis, I'd be holding it. Once I've done that, I've lost that hand. I can no longer use it. It is unsterile. That's why I said, make sure you have this all set up. Otherwise, if you don't, I now have one hand to pull that sleeve off, put that syringe on, and try to get it all set up. So make sure you get all this set. We're ready. Now I'm over here to prep. And just for, can everybody see this pretty well?
Mm-hmm.
All right. Can y'all see? Okay, hold on. I'll hold it up here. I'm gonna, just for prepping purposes, I want to show y'all. All right, so. So when I hold it open, I want it open, not, there you go, I got it open. This isn't open. I need it. I need to be able to see it. I need to be able to visually see where I'm going and all that. When it comes time to prep, I'm gonna take one swab. I will go, I say on the outside, I don't mean on the outside here. I want the farthest one, maybe. So I'm gonna do this side, down, one swipe, drop. Get my next swab stick, come to the one closest to me, swab down, drop. Final one, straight down the middle, drop. 3 preps, all right? All right, it's easier if I hold it up. If I'm doing a mill, for a mill, I will grab, hold, take one swab stick, start the tip here, and go down all the way to the base. Take another one, same thing, I'll do that 3 times, and that's how we prep for a mill, okay? Keep that hidden. All right, so let me move right here, have it ready. All right, so, and with females, I have to keep this open at all times. Let's just say, well, that's hard. On a real person, it'd be easier. No, on a real person, this has become so much harder because it's already naturally lubricated. There's already fluids down there. And then I put this prep on, now it becomes very slippery. And I'm like, come on, it's hard. So that may be, I need assistance. And it's okay if you need, I have the other person, so if he's my assistant, he might come in, okay, yeah, I'll hold open while I prep and all that then. Thank you, that's all I need. I just need another pair of hands, put a pair of sterile gloves on and come in here and hold. All right, so I've got it open. Prep. Prep. The other thing is also, as you notice, when I'm this way, you notice how I pull back towards me? If I was fully up here, I'd be doing the same thing. I would pull back and turn, because why do I not want to do this?
You already
I'm going to cross my sterile field, so that's why I pull back and then drop. Just don't like swipe and go straight across. So I keep it open, swipe, pull back, drop my last one. Now I'm ready to put the catheter in. All right, this is gonna be a trick shot here. All right, this is not part of the thing, but I have no lube right now, so. So I would have lube, I get my catheter lubed up. I would have kept that open. At this time, when I pick this up, the catheter is the most important thing. Keep that sterile. Everything else, the bag, the tube, all the rest of that stuff can touch anything. I don't care. The catheter is the most important. It's got to stay sterile. All right, I start to go in. Maybe. Without lube, it's not easy. All right, y'all know. Hold
I
on.
can't see.
It does usually easier if I have lube.
No such thing as too much lube.
Yeah, oh no. All right, the only thing I got to work with right now is water, so. It ain't the greatest thing, but we'll see how well. All right, so anyway, we try to go in. And the other thing is, I try not to touch here. I don't want to hit. I come back, I push a little bit. And then I'll push a little bit more. How far do I go in? That's
One
it.
or
So-
2 inches past urine.
So what you'll hear is, you'll hear the instructor probably say, you see urine. Not that you are in, you're in. Everybody know the difference? Because I always have, all right, you see urine, I'm in. No, you see urine, the yellow stuff. Oh, the yellow, okay. So you go in, I see urine. Now I go another, I go another inch. Sorry, now I'm having more problems here. Go another inch, 2 in. At that point, I should be good. At this time, I'm either going to take this hand and hold it, and I'll come back with this hand, because I'm done pretty much with sterile. I'm in the position I should be in. I'll come back, or I might take this hand, hold, and come back, whichever way you want to do it. But I have to keep somebody here to maintain and keep that Foley catheter stable. Come back and flirt. And the reason I do it on this one, not that one has a lot of working parts, electrical wires in it. It's a chance that the balloon did bust, it would get onto that and damage those machines. These are a little bit cheaper mannequins. They've got nothing in there for damage. So I'll pull back. I feel resistance. I don't yank it. Just a little tug. I feel resistance. I'm in. Disconnect. At this time, I am done with the sterile procedure. Sterile's done. Foley's in. Take gloves. Change them out to regular gloves. Take this. Now this leg will be a little bit closer. I will tape it to the leg, or I have a stat lock, a little sticker that you put on. Snap that on. Make sure I have slack in the tubing at all times. Because if not, if they stretch that leg and it yanks on it, it's going to hurt them. So make sure you have slack. The bag itself, then I'll take the tubing over the top of the leg, and where am I going to go? On the bottom of the bed, usually on the railing. There's usually some hooks or something down there. I think I've got one right here. There's some also great ones right down here at the end. Yeah, they're fine. But like I said, I'll hook that, then I will clean everything up. Now, on the checkoff, you won't totally clean this up because we're going to reset this kit again. But I will put that down, set everything up, clean up, cover the patient back up, put the bed in. The side rails are call light in.
Reach.
Or in reach, whatever. And what am I going to do?
Hand hygiene.
No, hand hygiene's overrated. Hand hygiene, and then go document. As you notice, the front and the end, I told you, are always the exact same, aren't they? It's the middle. You figure out the middle, everything else is going to be the same. Yes, question?
Do you have to change out of the sterile gloves after